very warm welcome to all the distinguished guests, speakers, healthcare leaders, attendees. May I please request you to please take your seats and put your phones on silent mode. We are about to start. Thank you. Thank you once again for joining this important conversation in regards to the future of healthcare that we have gathered here to speak. Good evening, everybody. On behalf of Pacific OneHealth, India's emerging chain of micro-hospitals, our esteemed partners, and in partnership with Avyukt Healthcare, I extend a hearty, warm welcome to everybody. Thank you so much for taking out time. Healthcare today is a turning point, and across workplaces, homes, communities, we are witnessing the rising levels of stress, obesity, burnout, absenteeism, and of course, mostly it is considered as an age-related issues in younger populations at an alarming pace. So here we are, perhaps this evening, the theme is very relevant when we are talking about metabolic wellness, metabolic reset, reclaiming our health in all best possible ways. It is not just discussions about tonight, it's about paving the way of solutions in this whole entire ecosystem that we have gathered all the stakeholders here. It's now my privilege to invite a visionary leader who has consistently championed integrated patient healthcare. Please join me in welcoming Dr. Swadeep Srivastav, co-founder and president Pacific One Healthcare. Before that, we have a short video of Pacific One Health.
Introducing Pacific One Health, healthcare as it should be. Where your care is our mission.
At Pacific One Health, our aim is to create a more approachable healthcare ecosystem. We have heard a lot of scary stories of patients being entrapped in large hospital black boxes. Here we are offering a more personal healthcare experience where your family's entire care continuum is taken care of.
At Pacific One Health, our motto is healthcare as it should be. Our model is designed to fill the missing gap in preventive, primary and daycare services while providing continuity of care through an efficient and effective module of secondary care, offering world-class medical and surgical facilities including IPD, state-of-the-art operation theatres, advanced diagnostics, compassionate intensive and critical care, and out-of-hospital services all under one roof.
I represent Pacific One Health Labs. We at Pacific One Health Labs have created a world-class infrastructure in the pathology section. So we are catering to all modalities of pathology, be it hematology, biochemistry, immunoassay, serology, clinical path, molecular biology, and microbiology. And very soon adding genomics. And we are doing all kinds of routine and specialized testing.
नमस्कार, मैं आपके स्वास्थ्य का साथी डॉक्टर GS ग्रेवाल पैसिफिक वन हेल्थ की तरफ से आप सबको एक बहुत ही यूनिक प्रोग्राम की तरफ इंट्रोड्यूस कर रहा हूँ। पैसिफिक वन हेल्थ ने एक सीनियर केयर प्लस प्रोग्राम लॉन्च किया है। इन एल्डर्स द फोकस इज नॉट जस्ट ऑन ट्रीटिंग डिजीजेस but is on two major pillars, and they are social health and geriatric syndromes. And Pacific One Health ने एक प्रोग्राम डिजाइन किया है कि इन्हीं दो को इंटीग्रेट करके जो सीनियर केयर प्लस प्रोग्राम में there will be a comprehensive assessment done for the requirements of every elder.
Our core philosophy hinges on two pillars. First, patient first. For us, the patient is the king. Second, medical excellence, as we are building a second home for our doctors, paramedics, and support teams.
Dr. Swadeep, would request you to please come on stage, please. Thanks.
Thank you, Kanikka. First of all, my heartiest thanks to all the dignitaries, delegates today who have taken out time in the evening to attend this program, which is around launching our metabolic reset programs at Pacific One Health. And the objective, while we were setting up this whole concept of micro hospitals in Delhi NCR, and we got a beautiful place in Lajpat Nagar, on Lajpat Nagar Ring Road, to start with a 25-bedded small boutique hospital. So while we were setting this whole program, we realized that generally the care continuum for larger, bigger hospitals starts from, of course, primary care is an integral part of it, and secondary care, but most of the focus, 70-80% for large hospitals, have always been the tertiary care, which is the real big thing for all the big hospitals. In last 25 years, 30 years, so many corporate hospitals have been built around that. So we realized that in this whole care continuum, the preventive care and wellness, which is always left out, though as a process hospitals offer these programs and packages, but there are very, very few who actually believe and promote this and practice this aspect of preventive healthcare and wellness, which is very much required in the healthcare ecosystem, not only in Delhi, everywhere across the world, but particularly in Delhi, the way the diseases and the metabolic problems and the lifestyle problems are growing. This is going to be one of the most important thing which we want to cover at Pacific One Health. We have started, this is a first program to formally launch it, but we already have all the packages and all the top leading experts who have joined us, and we look at not only the nutrition lifestyle but also the mental health aspect of overall wellness, and that's this program is all about. But when you talk of metabolic health and prevention and the overall managing the metabolic syndrome, this is incomplete without talking about one person I met 25 years back who also inspired me. When I saw him 25 years back, he said, he came out of the AIMS and he said that, okay, I'll set up a dedicated hospital for metabolic health. I think he was one of the first person who took that challenge, and he took that risk to setting up a small, I think it's about 30-bed hospital called Fortis CDOC. And that time it was a challenge. It was something different. It was a physician coming out and setting up a hospital around metabolic health, how it will run, though Fortis group was there to support it. But I think and that's why I feel that Dr. Professor Anup Mishra, everybody knows him in Delhi. So he is one person who has always been inspiring me, and we have done a lot of work together in terms of health education, health writers, capacity building training, overall health awareness aspect of metabolic health. We have done a lot of work together, but he has always inspired, first with his vision that yes, this such program is required in Delhi, and making it successful. Today, Fortis CDOC is a success story, no doubt about it, and making it so popular that it has become a first touch point for a lot of patients who look at primary care and secondary care in healthcare, is become the preferred hospital though being a smaller setup. And that's why Dr. Mishra was also awarded Padma Shri. And of course, if we keep talking about his awards and accolades, it's never ending. So he's so much well recognized, and most importantly, he's so well respected and loved by his patients from across the world. And that has been one of the big inspirations. So when I was also setting up this chain of micro hospital, so one of the inspiration was, okay, can we also build a small 25-bed hospital? Only difference is that I don't have Dr. Anup Mishra, but then I have got a lot of other experts together who have come in, and we will also try to learn from what Fortis CDOC has done, Dr. Mishra has done, and how we are going to set up this whole concept of community micro hospitals, which is very much required in the whole of country. Particularly, I would say the hinterland, the tier 2, tier 3 cities is more required, but even in a metro like Delhi, there's a huge gap, and that's our model, is 30 to 80 beds community micro hospitals, what we call. We started on this journey, but while we started on this journey, we always felt the best part and the actual justice is if we start with wellness, if we start with focusing on preventive health aspect of the overall healthcare journey. And that's why we are here today. We have, thanks to all the experts who agreed to join us in this journey. First is Dr. Aijaz Ilmi, a very known person in metabolic health in South Delhi, and Dr. Ilmi agreed to lead this program for us. That was a big thing for us, that he coming full time and leading this program with support of dietitian Kanikka Malhotra. She is a very popular person in the field of nutrition. Dr. Asthaa Dewan in mental health. Now we are having Dr. Nimesh Desai also joining in overall psychiatric, mental health and behavioral sciences. And most importantly, experts like Dr. G.S. Grewal. He is the elder care champion of Delhi, and he agreed to join us on board. And we were very fortunate to get Dr. Anirban Biswas, sir. He is considered to be the father figure of vertigo and balance disorder. He is the pioneer. He is the pioneer of vertigo balance disorder specialty development in India. And he agreed to come shift his base from Kolkata, and we have set up the first center of excellence of vertigo and balance disorder in this hospital at Lajpat Nagar, which will be formally inaugurating in June. And we are celebrating Vertigo Awareness Week for the first time in the country from 1st to 7th June. And this center is something worth coming, and it will provide a lot of real solution to a lot of patients who have been struggling, particularly in Delhi and NCR and North India, looking for the right kind of comprehensive treatment and care in vertigo and balance disorder. So with this, we are here today, and we'll formally start the program with keynote address of Dr. Professor Anup Mishra, sir. I requested him especially, sir, if you can come and give us a kick by doing a keynote address, and then our expert panel discussion, and then our program launch. We'll just play a small video on corporate wellness. Thank you so much again.
Every day, high-performing people are silently burning out. Fatigue, stress, and lifestyle disorders are becoming the new normal. Healthcare today is no longer just about treating illness. It's about restoring health at its root. Introducing the Pacific OneHealth Metabolic Reset Program, a clinically guided system designed to reset metabolism, improve energy, and reduce long-term lifestyle risk. Led by experts in preventive care, nutrition, and wellness, this is more than a diet plan. Reset metabolism, restore health, sustain results.
Our care content starts from preventive care to primary to secondary and higher secondary. That's why in last 6 months we conceptualized this program called Total Wellness. Today, this program comprising from nutrition, wellness to mental wellness and covering all aspects of wellness is being introduced for the community, for the corporates, for the people of Delhi, which is an important landmark for us. And we believe that this wellness program integrated with the healthcare delivery ecosystem
will play a very important role.
At Passive One Health, we follow the restoration of our metabolism as the primary stage to start stalling metabolic diseases. 80% of disease today is at cellular level, which means it's metabolic in nature. The idea is to restore health, restore your balance, restore your metabolism, so to allow the body to heal itself along with supplementation and essential medication. So our metabolic medicines program is meant for everybody to try and reverse and stall disease, which is the first step towards restoring your metabolic health. Therefore, your entire health is based on these parameters.
Today I want to tell you about an amazing metabolic reset program that we have. Now what makes this program unique is that in this program, we do not just take care of the physical health parameters, the disease parameters, but we also take care of the mental health and nutrition. And that is what makes it a holistic program. If we take care of the mental health of the patient, if the patient is stress-free, if he is happier or she is happier, it helps in metabolic reset. So that is what makes Metabolic Reset Program of Pacific One Health a unique program.
Thank you. Before we move to Dr. Noop Mishra's keynote address, I would just like to mention that we have a very special moment that we saved for this evening, the launch of OneHealth Live magazine that has gone tremendous efforts. Shanawazji, Dr. Kaul, a lot of work has gone into the magazine. May I please request the dignitaries to please come on stage and unveil the OneHealth Live magazine. So Dr. Sadeep Srivastav, Dr. Noop Mishra, Dr. Biswas, Dr. Gaurav Saxena, Dr. Abitav Gupta, Dr. Aijaz Ilmi, Dr. G.S. Grewal, may I please request you all to come on the stage to unveil the OneHealth Live magazine. Dr. Puneet, may I please request you as well to come on the stage and unveil the magazine, please. Thank you.
Also, I just forgot to mention thanking Avyukt Healthcare Solutions for being our partner for the evening today. Amitash is not here, but his team is here. Thank you so much for your support.
Moving ahead, ladies and gentlemen, our next speaker, Dr. Noop Mishra, hardly needs an introduction. I'll just try to say a few words, sir. A respected authority in diabetes, endocrinology, and metabolic diseases, he has significantly contributed to advancing preventive and metabolic healthcare in India. It is my honor to invite Dr. Noop Mishra, Chairman, Fortis CDOC Center of Excellence for Diabetes, Metabolic Diseases and Endocrinology, New Delhi. He will be delivering the keynote address on India's metabolic emergency, reimagining prevention, nutrition and lifestyle for the next decade. May I please request Dr. Noop Mishra to kindly take the stage. Thank you, sir.
Thank you, Sadeep, for inviting me here, and I'm very glad that you already opened the hospital, which is something which I also cherish. The subject is absolutely apt, and the metabolic reset is what is needed. So I wish you all the best for this hospital and multiple other hospitals. You've always achieved what you desired. So I'm sure there'll be no problems in success of your venture. And if there is anything that I can help, I'll be very happy. So Sadeep asked me to speak on India's metabolic emergency, and you may think, what is the emergency in this? You know, metabolic diseases are not emergency in the sense that this is not an accident. किसी को चोट नहीं लगी, किसी को emergency room में नहीं पहुंचना. But he is right. Sooner or later you'll reach an emergency. Not today, maybe tomorrow, maybe 5 years later, and you will not realize it. This is the problem with these metabolic diseases, कि आपके अंदर धीरे धीरे प्रॉब्लम्स चलती रहेंगी, आपको रियलाइज नहीं होगा. आप जाएंगे डॉक्टर के पास, आप कहेंगे हमको तो कोई प्रॉब्लम नहीं है, मुझको टेस्ट क्यों कराने हैं, मुझको किसी से और कोई मेजर सीटी स्कैन या समथिंग, उसकी क्या ज़रूरत है, मुझको कोई ज़रूरत नहीं है, मैं बिल्कुल ठीक हूँ. But once you start looking inside and in detail, then you find the problems which are already evolving. Now, गले तक पानी नहीं आया, इसका मतलब ये नहीं है कि आपको ऊपर तक पानी नहीं आएगा. This is the thing. These are the things with metabolic diseases. Now, if you look at this is our article, our research article in one of the highly respected journals called Metabolism. Just to make it simpler for you, this is the data for 5 diseases which are interrelated, so-called metabolic problems. Type 2 diabetes is at the top of the pyramid. Hypertension, obesity, perhaps a harbinger of all the problems. High total cholesterol and fatty liver. All 5 are interrelated. What this graph, these data show that a metric called disability adjusted life years is a measure of overall disease burden representing total years of healthy life lost due to illness, disability, or premature death. This is what these diseases do. Where is India? Where was it in 1990, and where is it now in 2021? So look at this. Diabetes, number 1, while it was number 2 earlier. Hypertension, number 2 earlier, number 2 now. Obesity, number 4 earlier, number 2 now. High total cholesterol, number 2, and fatty liver, number 1. This is the scenario. Currently, in 2026, possibly worsened. इससे ज़्यादा problems शुरू होगा, और रोज ही हम देखते हैं, not only in adult people. These are the problems that we see in younger people. So we see diabetes at 20 years of age, blood pressure, fatty liver, fibrosis of the liver means damage to the liver, and the cholesterol problems or even heart attack. Just to give you an example, this is the publication of my friend Naveed Sattar in Lancet, the top journal in the world. It shows comparison of 2 types of people. One is Indian population, the other is white population. And if you look at this is the curve of blood sugar from normal up to this is normal, and then this is a pre-diabetes, and this is diabetes. तो आप देखेंगे कि ये कर्व इतना फास्ट राइज कर रहा है इंडियंस में कि एक डिकेड पहले वेस्टर्न पॉपुलेशन से, एक डिकेड पहले, 10 साल पहले डायबिटीज हो गई. बट यही बात नहीं है. अगर आप इसको यहाँ पर प्री डायबिटीज की स्टेज पर रिवर्स करना चाहें, आप डाइट से, लाइफस्टाइल से या किसी से रिवर्स करना चाहें, तो आपको दुगना मुश्किल होगी बनिस्बत की वाइट पॉपुलेशन में, उनको उतनी मुश्किल नहीं होगी। तो हम लोग की बॉडी ऐसी है जो कि मेटाबॉलिक वर्सनिंग के लिए है, ये समझ लीजिए ट्यून्ड है। आई विल शो यू मोर। अब ये देखिए, ये मैंने बनाया है हैंड ऑफ एल्डरली। डॉक्टर साहब यहाँ पर हैं, डॉक्टर अग्रवाल, who sees lot more patients like this than me. But what I want to put in perspective is aging of the population. Look at this, accelerated aging. Anybody remembers this kind of phase in anywhere apart from doctors? Correct, absolutely. So what is it? This is the progeria syndrome because of mutation in a gene called lamin A gene. Now, this causes a huge number of problems at a very early age, and death by 14, 15 years of age. This is a prime example of accelerated aging. This is another example of accelerated aging, where the things age in a faster manner, लेकिन आपके जो भी इनसे प्रभावित हैं उनकी डेथ उतनी जल्दी नहीं होगी। ये देखिए, ये एक और मूवी है, जैक, रॉबिन विलियम्स की, एक्सेलरेटेड एजिंग। यही सिंड्रोम था उनको, सिंड्रोम, वर्नर सिंड्रोम। तो इसमें करीब 30-40 साल में डायबिटीज, हार्ट अटैक, डेथ सब हो जाते हैं। ये 2 एग्जाम्पल मैं इसलिए लाया हूँ क्योंकि हमारे सारे इंडियंस में एक्सेलरेटेड एजिंग चल रही है। एवरी डे आई सी पीपल हु हैव एज बियॉन्ड द ईयर्स, और जब हम उनके अंदर देखने लगे तो उनके अंग और भी ज़्यादा एज हो गए। जैसे कि अगर 40 साल के किसी का आदमी को देखें तो हमें वापस कुछ, देयर इज सम वेज आई कैन डिटरमिन इंटरनल एज। तो 20 साल बाद की एज, 60 साल, 65 साल। अगर आप देखें तो जीन्स हैं जो कि एज को, जीन्स आपने ऑलरेडी देख लिया पिछले वाले उसमें। एनवायरनमेंट है, पॉल्यूशन से भरा एनवायरनमेंट। न्यूट्रिशन एक्सट्रीमली इंपॉर्टेंट, एंड आई विल टॉक अबाउट लिटिल बिट अबाउट न्यूट्रिशन और फिजिकल फिटनेस। अगर आपके हाथ में क्या है, आपके हाथ में ये 2 चीज़ें हैं, न्यूट्रिशन और फिजिकल फिटनेस। अगर ये 2 अचीव किया तो आपकी शायद एजिंग जो फास्ट जा रही है उतना फास्ट नहीं जाएगी, थोड़ा सा स्लो हो जाएगी। और देखिए, ये सेल में, जैसे कि पहले बताया गया कि सेल में डिस्ट्रॉय करती है और साथ में जो जीन है उसको ऑल्टर कर देती है। तो कोई भी जीन हो, चाहे हार्ट का जीन हो, चाहे लिवर का जीन हो, कहीं का, और इसके कारण हमारे इस तरह के डिजीज, ये कुछ मैंने एग्जांपल दिए हैं। तो जैसे कि डायबिटीज़ है, या हार्ट अटैक है, या कैंसर है, या इम्यून डिक्लाइन है, ऑल्टर्ड बॉडी कंपोजिशन है, या कॉग्निटिव डिक्लाइन है, ऑल इज cause of accelerated aging because of our unfitness, because of our nutrition and possibly our environment. अगर ये आप देखेंगे तो ये हमारा बॉडी कंपोजिशन है, पेट का एमआरआई है। पेट का एमआरआई क्या दिखा रहा है कि ये फैट जो कि सबक्यूटेनियस फैट है, बिलो द स्किन है। अगर आप अपने स्किन को पिंच करेंगे इतना बड़ा फैट आ जाएगा, चाहे आदमी हो चाहे औरत हो, दोनों को। और ये फैट जनरेट करता है टॉक्सिक सब्सटेंस एवरी डे। दोनों चीज़, ये फैट और इंट्रा एब्डोमिनल फैट। तो इसीलिए मैं अक्सर, आपने देखा होगा मेरे स्टेटमेंट अखबार में, कि एब्डोमिनल फैट इज़ द मोस्ट इम्पॉर्टेंट फैट। अगर हम एब्डोमेन की सर्कमफ्रेंस, गर्थ को कम कर दें तो हमारा टॉक्सिक सब्सटेंसेस कम हो जाएंगे और कुछ हद तक हम फिटनेस के लेवल पर पहुंच जाएंगे। अब मैं 5 चीज़ें बात करूंगा डाइट के बारे में, और ये मेरी बुक है। मैंने स्वदीप से बात किया था कि आई कैन शो यू द बुक। ये अभी रिलीज़ हुई है, स्मार्ट कैलोरीज एंड कॉमन सेंस। इसमें करीब 20 चीज़ें हमने कॉमन लोगों के लिए, डिबेटेबल जो न्यूट्रिशन के इश्यूज हैं, सब मैंने एविडेंस बेस इसमें लिखा है, जिसके पीछे एविडेंस हो। ये नहीं हेयर से कि किसी ने व्हाट्सएप कर दिया, किसी ने इंस्टाग्राम पर देख लिया, ये सब नहीं करा। ये प्रॉपर एविडेंस, ईच सेंटेंस इज बैक्ड बाय अ रेफरेंस। तो देखिए, नंबर 1, शुड आई टेक प्रोटीन सप्लीमेंट? आप में से कोई लेता है प्रोटीन सप्लीमेंट? ग्रेट, आप कहीं चले गए थे, अब वापस आ गए। और कोई? ओके, फोकस है मसल पर, वेट लॉस पर, डायबिटीज पर। सो एक यंग व्यक्ति और दूसरी थोड़ी सी ओल्डर महिला, दोनों में शायद ज़रूरत है। तो यही हमने इसमें कहा हुआ है कि शायद आप बॉडी बिल्डर हैं और मैडम अपने मसल बनाने के लिए करती हैं। ये कितना प्रोटीन चाहिए, इस बारे में डिबेट है। यूजुअल अगर आप देखें तो जितना आपका वेट है उससे थोड़ा सा कम प्रोटीन, 70 kg वेट है तो 60 ग्राम आपको प्रोटीन चाहिए। प्रोटीन, लोग कहते हैं कि साहब कहाँ से लाएं हम प्रोटीन, हम तो नॉन वेज नहीं है, हम तो वेजिटेरियन है। तो वेजिटेरियन है तो हम प्रोटीन के सोर्सेज ही नहीं है। गलत बात है। प्रोटीन के सोर्सेज वेजिटेरियन में बहुत हैं, प्रोवाइडेड आप सही तरीके से खाएं। नंबर 1 प्रोटीन वेजिटेरियन, एनीबॉडी? पनीर और जो सोया कह रहा है वो करेक्ट है। सोया में नंबर 1 प्रोटीन है। इट इज पॉसिबली बेटर देन मीट एज फार एज प्रोटीन इज कंसर्न। अनफॉर्चुनेटली प्रॉब्लम ये होती है कि सोया का लोगों को स्वाद नहीं पसंद है या सोया के बारे में नहीं लोगों को पसंद है। तो सोया प्रोटीन में क्या होता है, प्रोटीन की मात्रा करीब करीब दाल से 6 गुना से 7 गुना ज़्यादा होती है। और साथ में एक स्पेशल तरीके का प्रोटीन होता है, अमीनो एसिड। एनीबॉडी? आपको पता होना चाहिए सर, बिकॉज आप यंग हैं और आप अपना शायद बॉडी बिल्डिंग कर रहे हैं। नहीं, मैं सोया प्रोटीन के अंदर छिपे हुए अमीनो एसिड की बात कर रहा हूँ। ओके, ब्रांच चेन अमीनो एसिड्स इसमें होते हैं। उसमें एक अमीनो एसिड है, उसका नाम है ल्यूसीन। ल्यूसीन अगर आप से 3 चम्मच 15 ग्राम के करीब 3 स्कूप अगर प्रोटीन लें, जो बाहर से पाउडर का प्रोटीन है, तो उसमें 2 से 3 ग्राम ल्यूसीन होगा। और ल्यूसीन क्यों इंपॉर्टेंट है? क्योंकि ल्यूसीन जो है आपकी मसल को दुगनी तरीके से बना सकता है बनिस्बत और कोई प्रोटीन। और ल्यूसीन, आप ने पनीर कहा, लेकिन किसी ने ये नहीं कहा कि रोटी में भी प्रोटीन होता है। ये लोग भी जानते हैं रोटी में 3 ग्राम प्रोटीन होता है। आप अगर 4 रोटी खाएंगे पूरे दिन में आपका 25% प्रोटीन रोटी से आएगा। लेकिन रोटी को आप बेटर बना सकते हैं, बेसन में 3 प्रोटीन होता है। तो देखिए, प्रोटीन के सोर्सेज वेजिटेरियन में बहुत हैं और ल्यूसीन सबसे ज़्यादा इंपॉर्टेंट है। और आपको लेना कैसे चाहिए? अगर आप बॉडी बिल्डिंग कर रहे हैं तो आपको बॉडी बिल्डिंग से पहले लेना चाहिए। और अगर आप वैसे प्रोटीन ले रहे हैं तो दिन में 3 बार उसको विभाजित कर देना चाहिए और 3 बार आपको लेना चाहिए। और कैसे लेना चाहिए? खाने से पहले या एक्टिविटी करने से पहले। खाने से पहले का क्या होगा? आपकी बाद की शुगर भी लो हो जाएगी। और एक्टिविटी पे करने से पहले क्या होगा कि आपकी मसल में 35% ज़्यादा ग्रोथ आ जाएगी, एटलीस्ट बिल्डअप हो जाएगा। और ल्यूसीन होगा तो इसको कहते हैं ल्यूसीन ट्रिगर। ल्यूसीन ट्रिगर, अगर हम 6 ग्राम के करीब ल्यूसीन दें रोज तो ल्यूसीन ट्रिगर करती है मसल ग्रोथ को। एल्डरली में ज़्यादा देना पड़ता है हमको। तो अगर किसी की उम्र 60 साल 70 साल से ज़्यादा है तो हम उसी तरह से, उसके लिए और भी चीज़ें हमको देखनी पड़ती हैं। हमको किडनी की हेल्थ देखनी पड़ती है, हमको ये देखना पड़ता है कि आप टॉलरेट कर पाएंगे प्रोटीन या नहीं। लेकिन हम अपर लिमिट पर 1 ग्राम पर केजी से ऊपर भी जाते हैं प्रोटीन, डिपेंडिंग ऑन द प्रोफाइल ऑफ द पेशेंट। तो हर का अलग अलग प्रोफाइल है, उसका डिटर्मिनेशन आपके फिजिशियन या आपकी डाइटिशियन करेंगे। तो ये तो हो गई प्रोटीन की बात। तो दूसरी चीज़ हो गई फास्टिंग। अब बहुत महिलाएं आती हैं, कहती हैं कि हम तो फास्टिंग करते हैं, हमारी हेल्थ कैसे ख़राब हो गई, किस तरह से ख़राब हो गई। लेकिन ये बात फास्टिंग वाली हमेशा खराब नहीं है। अगर आप सोचें कि मैं फास्टिंग को क्रिटिसाइज करने आया हूँ, नो। देखिए, स्टडीज इन एनिमल शो कि फास्टिंग प्रोलॉन्ग्स लाइफ बाय मैनी डेज और मंथ्स, बिकॉज कई एनिमल्स होते हैं उनकी लाइफ साइकिल बहुत छोटी होती है, तो उसमें हम स्टडी अच्छी तरह से कर सकते हैं कि भाई लाइफ साइकिल कैसे प्रोलॉन्ग हो। तो फास्टिंग से प्रोलॉन्ग होती है। लेकिन अगर आप इंटरमिटेंट फास्टिंग करेंगे तो क्या आपको कोई फ़ायदा है? ये करंट डिबेट दूसरा नंबर है डाइट का। आपको कोई फ़ायदा है? क्या आपका वेट लॉस होगा? क्या आपकी डायबिटीज़ ठीक होगी? या फिर कोई और फ़ायदा होगा? तो देखिए, इसमें मैं आपको निराशाजनक चीज़ें बताऊंगा कि इसमें कोई फ़ायदा नहीं होगा। तो जो लोग इंटरमिटेंट फास्टिंग है वो मुझसे लड़ते हैं, मुझसे दुखी होते हैं और इंटरनेट पर और उस पर ट्रॉल करते हैं मुझको। लेकिन जो सत्य है वो सत्य है। ये जो कंपैरिजन की स्टडी है इंटरमिटेंट फास्टिंग और जो यूजुअल रिस्ट्रिक्टिव डाइट होती है, कि मैंने कहा कि आप 1600 कैलोरी खा रहे हैं, आप 1400 कैलोरी खाइए, वो डाइट वर्सेस इंटरमिटेंट फास्टिंग, दोनों में कोई फ़र्क नहीं एज फार एज वेट लॉस इज कंसर्न, एज फार एज मेनी अदर आउटकम्स आर कंसर्न। इनफैक्ट इंटरमिटेंट फास्टिंग, जो कि चाहे 16 घंटे की फास्टिंग एक दिन में करें, चाहे आप एक हफ्ते में 2 दिन फास्टिंग करें, 5 दिन ना करें, इस तरह से कई रेजिमेंट हैं। आप जब नॉन फास्टिंग पीरियड में आते हैं तो आप सामने कुछ भी होता है वो खा लेते हैं, वो जंक फूड भी होता है, और उससे आपकी मेटाबॉलिज्म में क्या होता है, ये एक स्टडी हमने पब्लिश करी थी, मैं एक जर्नल का एडिटर हूँ, जिसमें कि उसने दिखाया था कि हार्म होता है इंटरमिटेंट फास्टिंग। तो जो लोग कर रहे हैं वो छोड़ दीजिए और आप यूजुअल रिस्ट्रिक्टिव डाइट पर विद हाई प्रोटीन मोड पर आ जाइएगा। अब क्या लोग कहते हैं, साहब क्या आप आयुर्वेदा को सपोर्ट करते हैं? कई लोग नहीं करते हैं। तो आपने देखा होगा इंटरनेट पर बहुत से डॉक्टर हैं वो कहते हैं कि आयुर्वेदा बिल्कुल बेकार चीज़ है, और कई लोग कहते हैं बहुत अच्छी चीज़ है। तो हम क्या कहते हैं, मैं तो एविडेंस पर देखे बिलीव करता हूँ। आयुर्वेदा का कोई एविडेंस है अगर, मैं बिलीव कर लेता हूँ। तो इस तरह से देखिए, आयुर्वेदा में दालचीनी का बहुत इस्तेमाल किया गया है, इसको कहते हैं न्यूट्रास्यूटिकल। अब सिनेमन के, अब सिनेमन में हमने डबल ब्लाइंड रैंडमाइज्ड ट्रायल किया। डबल ब्लाइंड मतलब एक ग्रुप, जैसे आधे लोगों को यहाँ पर डिवाइड कर दिया, इनको हमने सिनेमन दे दिया कैप्सूल में, और आधे लोगों को हमने कुछ भी नहीं दिया, वो कैप्सूल में कुछ भी नहीं था। और वो कैप्सूल में क्या किसी था, ना डॉक्टर को पता ना पेशेंट को पता। इसको कहते हैं डबल ब्लाइंड रैंडमाइज्ड कंट्रोल ट्रायल। इसको हमने बहुत अच्छे जर्नल में छापा और देखा कि आधा चम्मच रोज अगर आप लेंगे आधे गिलास पानी में सिनेमन, तो आपका ना तो शुगर ही भी नीचे जाएगी, उसके सिवा आपका लिवर, आपका बॉडी कंपोजिशन सब बेहतर हो जाएगा। तो देखिए, विथ कॉन्फिडेंस आपके सामने कोई भी शक नहीं मेरे दिमाग में ये कहने के लिए कि अगर आपको लेनी है कोई वो, तो सिनेमन इज द बेस्ट। नॉट मेथी, नॉट जामुन, cinnamon is something which should be taken by everybody except a couple of people like pregnant women वगैरह को नहीं लेनी चाहिए। चौथा, ऑयल्स। हमारे पास आते हैं लोग रोज, और इस पर भी मेरी बड़ी क्रिटिसिज्म होती है, लेकिन आई स्टैंड फॉर द ट्रूथ। लोग कहते हैं साहब हमारा तो पूरा खाना घी में बनता है, और सुबह पराठा और दोपहर को हम घी में दाल में डालते हैं और रोटी के ऊपर डालते हैं, और शाम को भी ऐसे ही करते हैं, और उनके हार्ट की आर्टरीज में ब्लॉकेज हम देख रहे हैं, उनकी कैरोटिड डॉपलर में, यहाँ पर सब जगह आर्टरी में हमने ब्लॉकेज देखा। तो देखिए, फोकस है ऑयल का लिवर, हार्ट और मेटाबॉलिज्म। इस तरह के ऑयल जैसे हम यूज़ करते हैं, हमारी जनता यूज़ करती है, वैसे कोई और देश यूज़ नहीं करता। केवल पाकिस्तान है, हम लोग हैं, श्रीलंका है, ये सब लोग यूज़ करते हैं, और कोई नहीं यूज़ करता। और उसके कारण क्या होता है कि हाई सैचुरेटेड फैट ऑयल जो हैं, जिसमें घी शामिल है और कोकोनट ऑयल शामिल है और पाम ऑयल भी शामिल है, वो अंदर जाकर जम जाते हैं और निकलते ही नहीं हैं। आपका कोलेस्ट्रॉल ऊपर कर देते हैं, और कोलेस्ट्रॉल अगर आप कोई दवा भी नहीं ले रहे हैं तो वो कोलेस्ट्रॉल आपकी आर्टरीज को धीरे धीरे करके बंद कर देता है। और आप समझते हैं कि आपने ट्रेडमिल टेस्ट करा लिया तो सब ठीक है, कुछ ठीक नहीं है सर, क्योंकि ट्रेडमिल टेस्ट बताएगा 75% आर्टीरियल ब्लॉकेज। हमको तो उससे पहले ही रोकना है ना, 20% पर, 30% पर, 40% पर। तो लोग कहते हैं साहब हमारा ट्रेडमिल टेस्ट ठीक है, मेरा हार्ट ठीक है। दिस इज व्हाट पीपल से। द बेस्ट ऑयल्स आर दोज जिसमें कि पॉली अनसैचुरेटेड फैटी एसिड होते हैं जो कि हार्ट को ठीक रखें, मोनो अनसैचुरेटेड फैटी एसिड होते हैं जो कि हार्ट को ठीक रखें, या फिर ओमेगा 3 फैटी एसिड होते हैं जो हार्ट को ठीक रखें। तो बता दीजिए कौन सा ऑयल बेस्ट है मैडम? डॉक्टर साहब कह रहे हैं नो ऑयल इज परफेक्ट। आई एग्री विद यू सर, एब्सोल्युटली एग्री विद यू, बट द बेस्ट ऑयल रिमेन्स cheapest and the best remains mustard oil. It has monounsaturated fatty acid, very low saturated fat and omega 3 fatty acid. जो आप एक्सपेंसिव ऑयल पर जाएंगे तो ओलिव ऑयल जो मैडम ने कहा, और बीच में कहीं कैनोला ऑयल है और राइस ब्राउन ऑयल है। अगर ये 3-4 ऑयल का आप इस्तेमाल कर रहे हैं लिमिटेड मात्रा में तो आप सेफ रहेंगे एज फार एज योर लिवर इज कंसर्न एंड एज फार एज योर आर्टरीज आर कंसर्न। क्या कह रहे हैं सर? सर करेंटली मैंने आपको जो कंसिडर्ड ओपिनियन है वो मैंने बता दी। बाकी देखिए लोग कुछ भी कहते रहें, जो जो एविडेंस है वो एविडेंस है। हाँ जी, 100% चेंज होता है सर, जो आज है वो कल नहीं। लेकिन बात यह है कि हमने 30 साल में इतनी रिसर्च करी है ऑयल्स लेकर सब चीज़ों पर कि हमको उतना कॉन्फिडेंस है कि जो हमने किया है वो ट्रूथ है, साइंटिफिकली ट्रूथ है। Oh, you can change the oil, sure. डॉक्टर साहब ने कहा ना कि नो ऑयल इज़ परफेक्ट। देखिए फाइनल वो, क्योंकि मेरे पास लिमिटेड टाइम है, फाइनल वो ये है कि आर्टिफिशियल स्वीटनर्स। तो महिलाएं आती, यंग महिलाएं हमारे पास कहती हैं साहब हमको ऐसी चीज़ दीजिए वेट लॉस हो। तो मैं तो आर्टिफिशियल स्वीटनर्स लेती रहती हूँ, मैं चीनी नहीं लेती हूँ, तो उससे क्या आगे जाकर क्या होगा मेरा वेट लॉस? तो मैं कहता हूँ नहीं होगा, बिकॉज यहाँ आपने कहा कि एविडेंस चेंज होती रहती है। एविडेंस पहले था 10 साल पहले कि साहब शायद वेट लॉस हो जाए, बट आफ्टर दैट एविडेंस उल्टा ही हो गया है। अब ये है कि वेट गेन हो जाएगा आपका और आपको डायबिटीज़ भी हो सकती है अगर आप आर्टिफिशियल स्वीटनर्स का ज़्यादा इस्तेमाल करें। क्यों? क्योंकि ब्रेन में आपके सेटाइटी आएगी नहीं आर्टिफिशियल स्वीटनर। ब्रेन इज नॉट सूटेड फॉर आर्टिफिशियल स्वीटनर। It doesn't recognize artificial sweeteners. It only recognizes sugar. So, if you don't eat sugar, if you eat artificial sweeteners, it doesn't recognize, you tend to eat more. And so, the result is opposite. So, actually जो weight loss के लिए इसके लेते हैं वो छोड़ दें। इसके सिवा अगर आप डाइट कोक लेते हैं उसमें भी आर्टिफिशियल स्वीटनर्स है, बहुत सारी और चीज़ों में होता है आर्टिफिशियल स्वीटनर, तो हार्म और क्या हो सकती है? कुछ छोड़कर, 1-2 छोड़कर आर्टिफिशियल स्वीटनर एस्पार्टेम वगैरह जो यूज़ करते हैं ये कोक में, वो कैंसर की तरफ बढ़ा सकता है, मल्टीपल कैंसर। देखिए ये आर्टिफिशियल स्वीटनर की स्टोरी जो है ना, बिसेट विथ प्रॉब्लम, सैकरिन से ऊपर कैंसर, फिर उनका नहीं कैंसर, फिर और से ऊपर कैंसर, फिर नहीं। बट करंटली जो एविडेंस है वो लार्ज स्केल ट्रायल्स की है। दूसरा और अभी आते हैं सर, वो उस पर आते हैं। दूसरा और स्टीविया, लॉन्ग टर्म स्टडी कोई है ही नहीं स्टीविया पर। तो आप अगर आप स्टीविया की लीफ लेंगे तो आपकी किडनी में प्रॉब्लम हो सकती है। अगर प्योर स्टीविया लें तो शायद कोई प्रॉब्लम ना हो, लेकिन लेवल ज़रा अच्छी तरह से देख लीजिएगा, क्योंकि उसमें एरिथ्रिटॉल करके एक दूसरा स्वीटनर भी मिला दिया जाता है। एरिथ्रिटॉल से क्या प्रॉब्लम है? हार्ट अटैक सीधे होता है। तो देखिए ये चीज़ें यू हैव टू बी केयरफुल। करंट एडवाइस, माई एडवाइस इज that don't take any artificial sweeteners. Even for diabetic, I say कि आपको शुगर आधी चम्मच लेना है तो आप सुबह की चाय में ले लीजिए, आर्टिफिशियल स्वीटनर ना लीजिएगा. इस तरह की कम से कम 20 मिथ्स और बहुत डिटेल मेरी इस बुक में है. ये जो बुक अभी पब्लिश हुई है 10 दिन पहले, ये बुक है, ये अमेजन पर वो है. इसमें केवल एविडेंस है, इसमें हेयर से नहीं, इसमें लोगों के मुंह की बातें नहीं, इसमें कोई व्हाट्सएप नहीं, और इसमें कोई भी इंस्टाग्राम की चीज़ें नहीं. Sadeep, thank you so much for inviting me here. I would have gone on for more than 1 hour, but I think this time is
Thank you, Dr. Mishra, for such an insightful, thought-provoking keynote. I remember, sir, 20 years ago, when I was studying nutrition at Lady Irwin College, I was attending Dr. Mishra's session in a symposium that inspired me to take metabolic syndrome as my research topic, sir. That was 20 years ago. So thank you for inspiring. On behalf of the entire healthcare fraternity, thank you for all that you do. May I please request Dr. G.S. Grewal and Dr. Biswas to please felicitate Dr. Anup Mishra. Thank you. We now move to a very important segment of today evening, the panel discussion. And the conversation brings together experts from preventive medicine, behavioral health, workforce wellness, and the healthcare financing to discuss how India can shift from reactive care to preventive recovery-first healthcare. I would like to invite our esteemed panelists, Dr. Aijaz Ilmi, Senior Consultant and Head, Preventive Health, Metabolic and Corporate Wellness, Pacific OneHealth, Dr. Amitabh Gupta, Chief Business Executive, ACE Insurance Brokers Private Limited. Can we have a round of applause, please, for our panelists? Thank you. Dr. Gaurav Saxena, can we please have you on stage, sir? Head Medical Services, JCB India Headquarters, and Dr. Asthaa Dewan, Stress Management and Behavioral Health Specialist, Pacific OneHealth. I'll just quickly introduce the panelists. Dr. Gaurav Saxena, Head Medical Services, JCB Headquarters, Faridabad. He's an accomplished occupational health physician with over 19 years of experience in corporate healthcare, employee well-being, and preventive health. He's an MBBS gold medalist and AFIH patch topper and leads currently strategic health and wellness initiatives at JCB India. He was previously associated with Reliance Industries and has actively contributed to occupational health leadership across India. We welcome you, Dr. Gaurav Saxena. Acha. I thought he's here. All right. Moving ahead, we have Dr. Amitabh Gupta, Chief Business Executive at ACE Insurance Brokers Private Limited. He's a radiologist by education and author of 11 medical books. He's a founding member of TPA industry in India and was the CEO of Paramount TPA and Director of Good Health Insurance TPA in his previous roles. He was also the founding member of Kokilaben Dhirubhai Ambani Hospital and Reliance Foundation Hospital, Mumbai, and as an entrepreneur, he has led about 7 companies with a couple of companies in wellness and home healthcare space as well. He was instrumental in designing and implementing the RSBY, which is currently called Ayushman Bharat, and he serves currently as the Chief Business Executive of ACE Insurance Brokers, a Blackstone Group company. We welcome you, sir. We also have Dr. Aijaz Ilmi, Senior Consultant and Head, Metabolic, Preventive and Corporate Wellness, Pacific OneHealth. He's a physician with over 3 decades of experience in metabolic health and preventive medicine. He's an MBBS graduate from Bangalore University, and prior to Pacific OneHealth, he has served as Head, Metabolic Clinic and Functional Medicine at Helvetica Diagnostic and Healthcare. We welcome you, Dr. Ilmi. Thank you for joining us. We also have Dr. Asthaa Dewan, an experienced behavioral behavioral health specialist and a mental health expert associated as Pacific One Health, and she brings to the table more than 2 decades of experience in psychology and behavioral medicine. We welcome you, Dr. Asthaa. And I shall be moderating the discussion. So this is a very important conversation that we have with this extremely talented panel that we see on the here. The metabolic health perspective, why India needs a dire need to move towards the right perspective of metabolic health care. And I would like to start with Dr. Amitabh. Dr. Amitabh, healthcare costs are going higher and higher, and broadly they are linked with chronic care ailments. It's rising rapidly. So from an insurance and risk management perspective, how urgent is the need to move towards prevention first healthcare?
Okay, I've jotted down a few points actually to reply to something like this. Let me set the context first. You know, about 2.5, 3 decades back, when we coined the word cashless for our upcoming health insurance sector in the country, we knew that one day it would be in a driver's seat to bring about necessary changes in our country, especially in the absence of, health regulator. So I feel that health insurance industry as a whole, we've done so much, to contribute towards the healthcare ecosystem in our country. If I have to talk about how we started and where we are today, so health insurance was a very minuscule part of the entire ecosystem of general insurance 2.5 decades back. But today, it is the largest segment and constitutes about 45% of the entire general insurance portfolio. While the health insurance sector is growing at about 15%, the general insurance sector is only growing at 10%. So you see, over a period of time, this is poised to become about 60% of the entire insurance sector. And let's understand as to how important the entire gamut of healthcare is going to be for the insurance companies, which also includes managing, healthcare as a whole. So currently about, if I have to talk about numbers before I actually move on to this, more than between 70 to 80 crore Indians are actually one way or the other covered through various schemes or are insured in our country. And of course, this is only poised to grow once we also cover the missing middle, which government is also talking about and including them in Ayushman Bharat. So another maybe 8 to 12 crore Indians are going to get added in the whole ecosystem. So health insurance as a whole is a very bleeding portfolio. Now, why do I say that? It's because there has been no actuarial studies as of now as to what the premium should be and how the claims are going to come, especially with a lot of inflation, medical inflation, which is around 15% year on year. We have also seen in last 15 years the medical advancement which has happened. Most of the medical advancement which I feel has happened in the last 15 or 20 years, and which has also contributed towards rise in claim ratios or increase in per claim size. So, insurers today don't have a choice. You know why? Because what is happening today? Today, health insurance is all about fund management. I mean, there are there is no risk management over here, to be honest with you. And once risk management sets in over a period of years, then we will move towards prevention, preventive healthcare, wellness, and which is going to happen very, very soon, because there is a limit to how much insurance companies can bleed actually over a period of time. And also, what is going to contribute here is that in India, what we have today are only sickness products. That means, you use health insurance only when someone falls sick and they require insurance. We don't have comprehensive care products at all. And comprehensive care products will eventually set in the country, which means when we have OPD also, so starting from your OPD to your inpatient hospitalization is going to be health insurance, which will take care of your entire healthcare needs. There is no way that, wellness will not be seen as the best tool in order to manage healthcare. So preventive healthcare is going to be the future for our country from a health insurance perspective.
Thank you so much, Dr. Bita, for making it more obvious why preventive healthcare needs more attention. Dr. Gaurav, I would like to come to you, since Dr. Bitab has established the need why preventive healthcare is the future. What role can the leadership and organizational structure or the culture in your organization, from your perspective, can play in building healthier workplaces rather than just simply healthier employees, or rather the disease first approach when we talk about preventive healthcare?
Nice question. So I will just say and take forward from Dr. Amitabh ji ने जो कहा that preventive part is secondary, but right now we are facing a phase where already the preventive part has taken a stand. Yeah. See, vaccinations and other factors, including other nutrition, metabolic and other factors, have already set in, and our insurers are already understanding that giving vaccinations, supporting us in those sections, reduces their bleeding and cost reductions. So there we have taken up these projects where we have analyzed the data. We have submitted this to the insurance companies and also to our management. Now the management has also understood a lot of factors that instead of just increasing the premiums every year and sitting back and going reactively, we have to proactively prevent the diseases from happening in the employees. Now, when we say ki employees and workforce, they are rightly said by Amitabh sir that they are bleeding actually. So what is happening is that we go reactive approach and proactive approach. Now there is a space where we have to launch proper approach where these diseases are metabolic. Say metabolic diseases like sir had already said, Mishra sir had very well jolted down the diseases. Now the diseases are not occurring at 55. I will say that people were retiring and these people had these diseases, and in 5 years they were supposed to retire, or say in 3 years they were supposed to retire. Now we are seeing this phase where these people are 35, 36. These are the prime people. From 20s they have learned something. Now they have a brain fog, they have a mental diseases, they have other issues. Now they are not able to focus. I will not say 100%, but 1 out of 3 is already having this kind of problem. Right. Now, seeing in this in senior management, the people who are healthier are getting a jolt for it. See, one person is not performing, the other person gets a burnout.
Yeah.
So mental health definitely takes a toll over there, and work output has to be there. Now, companies, as your question was, how the company can approach that. Yeah. So the context is very much set where the company has to take a proactive action. It cannot be that I will not look into the things. I will just take the work output and let us see. See, absenteeism is one of the factors. It's already there because of these diseases, but there is a problem with the presenteeism. The person is present in the office, but he is only working up to 60% to 70%. I will say it is far lesser. If the person is fit, he would be giving more output in a lesser time, in a better way, and making you productivity is also going down. So there, if you say ki company should be reactive, yes. Now how to be reactive? Now it's the main question. You cannot just say ki that I give you Fitbit, free Fitbits, I give you gym memberships, but I feel company cannot say that you do this after duty hours. And you cannot say a person to join at 7 o'clock, this is mandatory that you join a yoga session. I've been doing this online. Then you have to report at 9 o'clock in the office. And the senior management, no matter how much we deliberate or anybody deliberate for this thing, that you give yoga session and other factors, if your vice presidents roll out some message or a work for you around 12 in the midnight, there is no method or way that this stress can be reduced by giving you a lecture or giving you a yoga session, giving a Fitbit, giving you a walking step. If you do 10,000 steps, but not sleeping at night is not going to help you out. So management has to understand that company productivity has to be limited and it can be increased. I will say sleeping pods and other factors will increase your productivity. It will not reduce your productivity. If the person is giving you 100% output in your 8 hours, it would be far more if you make him continuously work for 24 hours with he will not even deliver for 2 hours or 3 hours. So there the productivity also goes down and the health of the employee is also going down. The main change and cliche is it's not the healthy employee, it's the healthy workplace. If you go for healthy employee, the onus is on the employee that I have to be healthy. But if you don't give him healthy workplace, he will not be able to maintain and sustain that. So that I closed.
As leadership team, we need to face that. But Dr. Ilmi, taking a excerpt from what Dr. Saxena just said, burnouts are there, absenteeism is there, presenteeism is there. If you had to identify simply 3 simple lifestyle interventions or go-to points of what can be done immediately to slightly reverse the metabolic risk at the workplace, what would those be in your opinion?
Thank you, Kanikka, for asking this question. We worked for many months on making our own wellness program for corporates, for school children, for our patients, using metabolic reset, basic and advanced and transformative. Because Dr. Musha talked about, and Dr. Sudeep also said, emergency. I mean, we are beyond that emergency. We are right now in the middle of a metabolic disease pandemic, starting from early childhood and involving our large workforce at 20s, 30s, 40s. All diseases are not happening, like you said, 55 now earlier. They're starting in 20s, 30s, early onset cancer, early onset metabolic fatty disease, early onset obesity, overweight. We are actually so unwell at all levels that you talked about presentism. I would say being present and yet being absent because of metabolic diseases, because you're not aware of what is happening to you. And I mean, we tend to ignore ourselves, whether it's pre-diabetes. 70% of the country is already pre-diabetic and diabetic, and half the cases are yet undiagnosed and underdiagnosed. So that's how the metabolic drift starts. It starts with glycation, leads to inflammation, leads to insulin resistance, leads to fatty liver, leads to mitochondrial dysfunction. That's why all of us are tired. You get up in the morning, you're exhausted. You don't know what to do because the mitochondria, which is in every cell, which is supposed to convert food into energy, is so under so much pressure of toxins, high sugar, and methylation defects, genetic defects, that you end up feeling exhausted because you can't absorb the vitamins, the D. We have an acute micronutrient deficiency, so our deficiencies are there. Our mitochondria are not working, so you're not able to perform, which is why it's very imperative that this metabolic assessment, risk reversal, and goes out to all the industries, because our workforce is there, our youngsters are there, our young generation, Gen Z, they're all suffering in the long term. I hope it's a clarion call that AIMS talked about. Children as young as 6 and 7 getting pre-diabetes and diabetes. We're seeing this in our clinics. We're seeing all these youngsters also. So we have to do something about it. let's not wait for things to happen. If we can do it for ourselves, our school children, our parents, our workforce colleagues, our neighbors, our communities, as microscopic hospitals are meant to do, we are going full throttle, and we aim to information, awareness, response, and identification, stratification, and reversal is our motto.
Right. So you mentioned about one word, emotional load, and that brings me to Dr. Asthaa Dewan. That, ma'am, do you believe that emotional eating or poor sleep quality or stress, anxiety, digital overload, the level of digital stimulation that we have in this whole scheme of things, is it silently contributing to the India's metabolic epidemic, if I can use that word?
Thank you, Kanikka, for that question. And because you use the word epidemic, I like to share some data about the health of mental health, or the extent of mental health problems that are there, or stress that is causing in corporate really. And this is a research done by WHO. It said 84% of employees are showing some signs of stress. Out of that 84%, 50% showed chronic signs of stress. And out of this 50%, 64% were in the age group of 21 to 30. So just imagine that this actual workforce, which is the most important ones, which are the doers in a corporate, right? Because otherwise, after 30, there are people who are managers, right? They're getting the work done. Now, these people are suffering so badly with the stress and stress-related problems, which we are saying emotional load, brain fogging, not able to focus, not able to give time, absenteeism, and all that comes later. As Dr. Gaurav said here, that they are in the office, but they are not giving productivity. In fact, WHO research also said that 1.1 lakh crores of money corporates are losing every year because of the productivity loss, right? So that is the extent. It's actually a epidemic that you mentioned, Kanikka. But I also want to share that why in Metabolic Reset program we've added mental health as well. Because if you see, for this generation, things are starting from the stress that they're carrying from their relationships to work, the stress they're carrying of the performance pressures, the stress they might be carrying from their childhood traumas, or anything that is going wrong in their life. Now, what is that doing is that is making them eat unhealthy. Then, that is how the metabolic, diseases starts from there, right? Wrong eating and stress, and then the lifestyle goes haywire. The entire, mental balance, physical balance is absolutely disturbed. So, metabolic health will definitely be, better if we are adding that with nutrition and mental health, because then we are able to bring the discipline, we are able to bring the right balance that is needed for a metabolic health reset. So that is how this pandemic can definitely be addressed when the program is holistic for a corporate organization.
Right. So metabolic health is no more just a personal problem or a workforce problem or a policy problem. It looks like a national problem to us. It's a pandemic that we are moving towards to. As we conclude this panel discussion, I would request Dr. Amitabh to give his closing remarks, sir, and take home message from the vast experience that you see. Where are we moving, and what is it that we need to do immediately?
Yeah.
So about a few years back, I ended up sending one colleague of mine to Dr. Anup Mishra. And my fellow colleague was diabetic with 8.5 HbA1c, and between 8.5 to 9.5 was something, and he was not taking medication. So I really scolded him and I said, you must go and visit the best doctor for this. And I fixed up the appointment. He's not here to hear it, but definitely one of you, whenever you see him, you can communicate that. When he came back, I said, "Kaun sa dawai diya?" He said, "I was not given any medication." I was slightly surprised, little shocked, and I did not know what to do. After some time, I realized what he was talking about with him was lifestyle modification, prevention, disease management, and what he actually briefed today. So if the best of the doctors are moving towards wellness, prevention, disease management without medications, this is the best possible news for everyone, and this is how the adoption of wellness and prevention and disease management will eventually happen. So I had quite a few things to say, but I would close with this because I think this is one of the most powerful things, a message which people like him and others can actually give to the society as a whole.
Thank you, sir. Thank you so much. Dr. Ilmi, would you like to add the case study that you were telling us in the concluding remarks?
Yeah. Amitash spoke about this because we see it very rapidly. A senior government employee comes to you, referred by a friend, of course, and he says, I've been having type 2 diabetes, hypertension, dyslipidemia, and micronutrient deficiencies for maybe 15 years. I'm on medication and put me on Mounjaro or Ozempic because nothing's happening. My A1C is stuck between 8.2 and 7.8, and I'm having 3 medicines and I'm having statins, and my muscles are getting weak. So what do we do now? What is to be done now is most. So I said, I will not advise you to take GLP agonist, Mounjaro. Give me 3 months' time. And I actually put him on a metabolic reset plan. From 160 fasting, it wasn't going down. And so anyway, when he came to see me last, on the third visit, his numbers were going down. He said, I'm free of diabetes. I am 6.1 HbA1c and my fasting is 85. Wow. And his liver enzymes are all normal. Inflammation levels are gone. Vitamin D and B12 are corrected. Only thing, he also had a methylation defect, which 50% of Indians, everybody has it, which is the most unknown thing. It should be investigated. It's called serum homocysteine level, because 50% of people have it, and that impacts no moods or anything. So I was very happy to see Mr. Kumar. So he just said to me, was I misled? I said, you weren't misled. People are understanding the importance of metabolic physiology now. You can't just be a reductionist glucose lowering mechanism by pharmacotherapy in diabetes medication. You have to look at the macronutrients, the liver, and also all these factors, hepatic unloading. There's a way of doing this. Your liver enzymes have to be managed. So there's a way of doing these things. It's called the metabolic reset, metabolic evaluation. So in Passive One Health, we have this metabolic staging to identify these things early and tell you are at this stage. If you don't change yourself, you're going to be here. Your risk factor is going to be higher. You're going to have cardiac
Sorry, I'm stopping you in between.
So
Dr. Ilmi, but we can take that in the presentation, so you can reserve those points for the presentation. Dr. Saxena, your closing remarks, please.
So my closing remarks are very simple, sir. Say that, see, you have to come from proactive to a reactive wala jo हमारा change over है, that has to be very sustainable, and it cannot be sustainable if you are not having a proper approach. So my approach would be, employer has to understand that he needs a work output. It is only possible and sustainable for 20 years if his employees are fit. It cannot be कि आप मुर्गी का अंडा एक ही बार में सारे निकाल लो, and then you land up in a place where you have an employee and you cannot take him out, but he is not productive for you. It is not employee that onus only depends on employee. Obviously, it is one's choice to be healthy, but if you put him in an environment where he is under constant stress, under, say, if I put him in night shift, there would be insulin resistance of 40%. If I put him, in a high stress like sales and marketing, there would be cortisol levels, there would be visceral fat, and there would be hypertension, which is imminent to come. Now, obviously, there would be a resilience. Resilience can come from yoga, come from steps, comes from diet and nutrition, and even somewhat from sleep hygiene. But all these things will only be helpful when the management and the things are in place. So you need a healthy workforce for the employee to be healthy. So corporate, I will not say कि people will say कि it's only corporate part that people are unhealthy. everybody is employed, including a student. उसके स्कूल में जितना स्ट्रेस मिलेगा वो बच्चा उतना ज़्यादा स्ट्रेसफुल रहेगा, उतना ही ज़्यादा ओवर ईटिंग करेगा, उतना ही ज़्यादा खाएगा और वो आगे जाके वही दिक्कतें आएंगी. Even an unemployed has its own stresses. An unemployed person will be more stressful for finding a job. He is going for interviews, he doesn't have a money, so obviously he will go for a junk food. वो वड़ा पाव खा के जिंदा रहते हैं. And you'll end up in the problem. Then they find a job, but then all the metabolic diseases have already set in. So no person in this world is not having a job. All job has some issues with them and some risk factors attached. Not only dust and other factors, but other चीज़ें भी हैं. तो मैं इसको यहीं पे conclude करना चाहूँगा without taking much time, that already sir has told that he had given 1 in 3 is already having metabolic problems in age of 33 to 35. Now we have to stay with them. Obviously there are two approaches, one is reactive and proactive. I will still say that there is a memory, glucose memory in the muscles and other factors. So I will still preach that initially they should be put on medicines. The medicines can be gradually taken off, but yes, there is a study where if we treat them early, they tend to have less complications on a later date. But if we give them only lifestyle, that should be a sustainable one. It cannot be that I give them 10,000 steps a week per day and follow them every week, and then maybe if they are sustaining it, I can increase the doses of the medicines or the steps. So if they follow that part, gym is not a solution. Taking supplements, खासतौर से जिम वाले supplements देख के मेरे आज के जो young persons हैं, I'm finding people had undergone gynecomastia. I have seen people have gone renal failures. IgA nephropathy has come in. Hair loss is there. Lot of factors are there. The problem is not with the say protein. It's a content of the protein. So nothing is pure. If you find pure, it's okay, but pure milta nahi hai. And then the requirement is not so much that has been percolated by the WhatsApp. Please consult your doctors or at least come to maybe metabolic experts and understand ki what you need to have in your body per se. इंस्टाग्राम देख के प्लीज़ आप ये मत सोचना कि भाई मुझे तो यार इतने सारे प्रोटीन का स्कूप्स खाने पड़ेंगे तब जाके ही मेरा मसल मास बनेगा. द मसल मास इज नॉट द क्वेश्चन, द प्रॉब्लम विद यू इज विसरल फैट. तो हमें एड्रेस वहाँ पे करना है, नॉट द अदर वे अराउंड.
That Dr. Mishra also spoke about it, the abdominal girth. Dr. Asthaa, your concluding remarks.
I will very, very quickly conclude. I liked something that Dr. Gaurav said in his previous answer, that it's not only the corporate wellness program that we need, but we also need that the organization should support it. The management should look at changing the culture. Management needs to understand that somewhere they are also going wrong in creating this epidemic or pandemic, right? And at POH, at Pacific OneHealth, our corporate wellness program, we are looking to collaborate with organizations like yours who really are sensitive and understand that the success of a corporate wellness program, it cannot happen only by a contributor, but the whole organization has to come together for that. Yeah. So that's all that I like to say. Thank you.
Thank you. Dr. Gupta, you wanted to add something?
Yeah, I just wanted to add something that in times to come, insurance companies will look at individualized health monitoring. So because today, whatever premiums they charge, they look at status of healthcare spread over a population, and that's how they decide their premiums. But here, we all know that every human body is different. So we are looking at individualized healthcare in very near future, and at the same time, the premiums of health insurance will go up and down based on how you are maintaining your healthcare. So whatever we talked about here today, is going to be very, very vital for each and every one of us.
Thank you. Thank you, Dr. Gupta. Thank you so much, panelists, for making it evident that healthcare cannot be reactive and individualization is the way forward. Thank you so much for sparing our time for this evening. Thank you so much. May I please request Dr. G.S. Grewal to please felicitate our panelists. Thank you.
आगे 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 कम आगे आगे head for clear picture. Kanikka ji, we want you in the picture. Yeah. In the 1990s, it was the insurance company in America that started taking a higher premium for overweight.